Good afternoon, everyone, and welcome to the COVID-19 update for Friday, December the 11th. Last evening, the FDA's Vaccine Advisory Committee, the independent panel of experts that reviews each vaccine candidate and offers a recommendation to the agency, offered its endorsement for the FDA to approve the Pfizer vaccine for adults 16 and older. Historically, the FDA rules in the direction of these panels. And in this case, with months of data indicating that this vaccine is safe and thus far 95% effective, the FDA's decision is all but imminent. Our own review panel is poised to review all available FDA data, and based on all information to date, the team is optimistic that this vaccine can safely move forward. Once the FDA approves the vaccine for medical use, the CDC's Advisory Committee, ACIP, will meet on Sunday to formally recommend the vaccine and offer additional insight on how it should be used. ACIP has already given out its recommendation for the very first rounds of the vaccine, which is going to healthcare workers and long-term care facilities. And we will rely upon their guidance for upcoming rounds as well. Federal officials have told us that these first doses will be shipped out to states within 24 hours of approval. And Illinois is prepared to quickly get this vaccine to our frontline healthcare workforce. I want to take a moment today to highlight some of our incredible healthcare heroes across the state, more than 650,000 strong, because it's their selfless sacrifice that has kept so many people alive in this pandemic. I'm thrilled that this vaccine will help keep their families and them safe while they do their life-saving work. As importantly, it gets all of us a little bit closer to the other side of this pandemic. I know so many of us carry grief for those who have been lost, concern for those who've been infected, anguish for the year that has been so personally challenging, for the birthdays and weddings that were celebrated in private, for the holidays away from family. I know that we wish this pandemic could be over right now and are tired of all the extra precautions that we still have to take because it's not. But when I think of all things that we've been through, it also reminds me of how incredibly lucky we've been to have such amazing doctors and nurses and all the incredible healthcare workers, from the janitors to the cafeteria workers to administrative assistants to social workers to EMTs to respiratory therapists to cardiothoracic surgeons and everyone in between. They've spent endless days of this pandemic putting themselves at risk and working to save lives. And when we wear our masks and we keep our distance, we're protecting not only ourselves, but all of those around us, and we're protecting them too. People like Dr. Andrew Lancia, Medical Director of the Behavioral Health Integrated Services at Unity Point Health in Peoria, and an Associate Professor of Psychiatry at the area's University of Illinois College of Medicine. In addition to direct patient care, Dr. Lancia has guided other frontline workers in the COVID-positive units through their own mental wellness, providing resources and guidance to help doctors here and around the world avoid burnout amidst the very high pressure, high anxiety persistence of this pandemic. And he's done it all while continuing to teach medical students, ensuring that the next generation of doctors can provide their patients with the best in care. People like Dr. Victoria Papella, the hospitalist at Memorial Hospital in Hancock County, a critical access hospital in west central Illinois. She covers emergency department shifts, works the clinic, serves as medical director of the hospital's 60-resident senior campus, and during this recent surge, a resident of the hospital herself. Dr. Popella has moved a cot into her office because she's now on call 24/7, managing critical care and keeping up with all the latest research, and doing it all humbly, with no interest in any fanfare. Or Jennifer Orozco, the Director of Advanced Practice Providers at Rush University Medical Center in Chicago. In her role, Jennifer organizes all available providers, from residents to fellows to physicians to advanced practice providers, throughout the hospital, ensuring that the hospital could properly care for as many COVID-19 patients as possible. In other words, Jennifer basically runs the hospital's pandemic air traffic control system, and she does it also while organizing Rush's testing services, which has now reached over 100,000 individuals. And then there's Roxanne Stell, the Chief Nursing Officer at Abraham Lincoln Memorial Hospital in Lincoln, Illinois. Roxanne routinely works extra hours, not just to support her patients, but to have the backs of her nursing team as well. Day and night, she answers colleagues' questions, facilitates patient admissions and transfers, and jumps in to cover staffing shortages whenever necessary. She truly leads by example. Whether it's the empathy of Andrew Lancia, the stamina of Victoria Popella, the vision of Jennifer Orozco, or the kind-heartedness of Roxanne Stell, may we all take a little bit of inspiration from the commitment of our healthcare heroes. If they can get through this, we can too. So thank you, and now I'd like to turn it over to Dr. Ezike for today's medical update.
Good afternoon and happy Friday. In the last 24 hours, 9,420 Illinoisans were newly diagnosed with COVID-19 for a total of 832,951 cases. Over the last 24 hours, we've gotten reports of 190 individuals who lost their battle with COVID, and that brings the total number of lives lost in Illinois to 14,050. Overnight, 5,141 individuals were in the hospital with COVID, 1,081 were in the ICU, and 635 were on ventilators. We do continue to see great testing numbers in the last 24 hours. Almost 105,000 tests were reported for a total of 11.5 million tests since the beginning of this pandemic. As we've said, testing is important for identifying cases, but it also allows us to quickly identify people who may have been exposed and slow the spread that way. I want to encourage people to check out the IDPH website to find testing locations, including the 11 free state-operated community-based testing sites. While we are recommending people to stay home this holiday season, I know there's some of you who are going to travel anyway. For those of you who will not heed this recommendation, or people who have family or friends traveling to see you, I do recommend testing before and after your visits or your travel. But please understand that having those tests does not really give you a free pass and ensure that there could be no transmission of infection. Someone who tests negative today could be exposed tomorrow or on the plane or in the airport and then spread the virus in the days after that. I just want everyone to be clear and not have a false sense of security that a negative test means that everything's A-okay and that there's no way that infection can continue to happen. Again, I'm strongly recommending that people stay home for the holidays. We will all be able to celebrate these holidays, Christmas, New Year's, maybe just postpone it a little bit. We want to have this pandemic controlled so that we have more of us here together to be able to celebrate for next year's and the subsequent years. Thank you so much. Hola y buenas tardes. Feliz viernes. En las últimas 24 horas reportamos 9,420 casos nuevos de COVID-19 para un total de más de 830,000 casos aquí en Illinois. También se reporta 190 muertes más relacionados a COVID-19. En total, más de 14,000 personas en Illinois han perdido su vida a este virus. Desde anoche, 5,141 personas estaban en el hospital con COVID-19, 1,081 en la unidad de cuidados intensivos y 635 personas estaban en ventiladores. Seguimos viendo grandes números de pruebas. En las últimas 24 horas se han reportado más de 105,000 pruebas para un total de más de 11.5 millones de pruebas hechas en Illinois. Pruebas son importantes para identificar casos, pero también nos permiten identificar rápidamente a las personas que pueden haber estado expuestas y la propagación del virus. Animo a las personas que se han descuidado. Por favor, háganse la prueba para proteger a ti y a su familia. Sin embargo, quiero advertir a las personas que hacerse la prueba no les da un pase libre de celebrar los días festivos con su familia de otras casas. Una persona que hoy da negativo en la prueba puede estar expuesta mañana y puede transmitir el virus en los días que sigan. No quiero que las personas tengan una falsa sensación de seguridad de que una prueba negativa significa que están seguros. Pero de nuevo, recomiendo que la gente se quede en casa durante los días festivos. Finalmente, yo sé que el sábado es el día de Nuestra Virgen de Guadalupe y sé que todos quieren ir a cantar las mañanitas, pero pido a los mexicanos de Illinois que por favor observen este día especial en su casa. Cante y ore en casa y por favor no reúna con otra gente. Muchísimas gracias por su apoyo. And with that, I'll turn it back over to Governor Pritzker.
Thank you very much, Doctor, and happy to take questions from members of the media. Good to see you again, Rick.
Thank you, Governor. Given what we know about the outbreak of LaSalle, the handling of it, apparent lapses involved in the oversight there, do you bear any moral responsibility for those deaths that occurred of those 33 veterans of LaSalle?
Look, I bear the responsibility of leadership of the state, and that means that everything that happens across state government to some degree or another lands on my shoulders. The veterans' homes are extraordinarily important. The people who live there are very important to all of us. We want to keep them healthy and safe. This virus has been so virulent, and particularly in areas where there is a very high prevalence of the disease, and where people who work at the homes live in the community, and in the communities sometimes there is not only a high prevalence of the disease, but also people not wearing masks and following any of the mitigations. These things can happen, and I think most importantly, the question is, at the time that people become aware on site of what's happening, what are their reactions? How do they care for people there and make sure that they're safe? And then what do we learn from that, very importantly, to carry on elsewhere to make sure that we're keeping all of our veterans safe?
Obviously the vaccine is promising news, but Dr. Redfield from the CDC yesterday said that Americans should be prepared for another 60 to 90 days, even with a vaccine, for this level of death. 3,000 in the U.S. Yesterday and possibly today, 190 in Illinois at the end of the week of more than 1,000. What should Illinoisans be prepared for in the coming weeks, in the coming months, even with a vaccine?
Well, the vaccine, because there is, relatively a smaller percentage of it that's available to people than anybody would like. We're only able, right in these early weeks, to service and provide the vaccine for healthcare workers and for those in long-term care facilities. That means that an awful lot of people are still going to be needing to wear masks and socially distance, and they're going to need to follow the mitigations and treat it as if the vaccine doesn't exist for them because it hasn't been manufactured yet to supply it to them. So that means we're going to see continued infections and continued hospitalizations, ICUs, ventilators, and ultimately deaths. Whenever I look at the death numbers on a same day, when I also see that our positivity numbers are going down and the infection numbers themselves are going down, even as we have, 110 or so thousand tests done, I think to myself, it's maddening to me, because the people are dying today, and it seems like things are getting better on the front end. And so why is that? And as I've said many times here, unfortunately, as we saw record numbers of cases some weeks ago, you have to look forward by 2 and 3 and 4 weeks, and sometimes a little more, and say there is going to be a certain number of people, because we don't have treatments that will save everybody, that are going to die. And so it is, I don't know what to say, except it is extraordinarily frustrating, and that if we don't continue to bring the number of infections down and the positivity rate down, if we can't continue that path, we're going to see these kind of high levels of death every single day. And it is devastating for all of us to have that happen. So I'm going to do everything I can to make sure that the mitigations are followed, to make sure that we have a lower number of infections, and to pray.
I mean, is there anything, is Redfield's assessment accurate in the sense that, it is winter time, the holidays are coming, is there anything in the next 60 to 90 days, short of, everyone wearing a mask, I guess, that would knock this down in terms of that?
I think I'd like the doctor to come up and give you her view as well. I mean, I over the last 9 months, I've tried every single day to do whatever I could to save people's lives, and I've followed the doctor's recommendations, not just Dr. Ezike's, the doctors, plural, the many epidemiologists and scientists, Dr. Fauci and others that I listen to do everything that I can do. And still people get sick, and still people die. But we have to, keep going. We have to make sure that people do as much as we can to keep each other safe. And there aren't any new solutions that people have offered. We've been following the best science that there is, and yet, as we've seen, even in really all over the country now, in places where they've been following the science included, the challenge is great. So, Doctor, do you have any comment about it?
We all want the deaths to come down. I think the green light, or the light at the end of the tunnel, is the vaccine, and getting as many people vaccinated as will be vaccinated based on the supply. But when we say all we can do is a mask, that can do it. That's more than enough to do it. To wear our mask and to refrain from these gatherings now, that would keep these numbers down. That would bring down the death totals. That would give a break to the healthcare workers that have been just overtaxed, overstretched in our hospitals right now. We are so fortunate we didn't get to the point where we had no beds at all. But if we don't keep on this path of trying to wear a mask and stay at home, we could have a big surge that we're already teetering. We have some areas where there are a dozen beds, a dozen ICU beds in the region right now. So a big surge cannot be handled. And that means that people who are coming in with a heart attack, people who are coming in post-car accident, that the staff will have to take on more patients at a time, which means you will get care that's not as great as it would be if you could do 1-to-1 or 1-to-2. So all of us have a vested interest in trying to protect our healthcare system, and we can do that with a mask. It's not just that's all we have. That's a big, powerful tool that we have, and the more we use it, the more benefit we have. We did have 9,000 individuals that were diagnosed today, so that means that even if everyone stayed in place today and didn't transmit any infection, we know that some percentage of those 9,000 individuals will die in maybe within 4 weeks, maybe 5 weeks. So there's always going to be that lagging indicator, which is always sad, every life lost, but we can do many things now to make sure that number goes down every single day.
And I guess I want to add one other thing. I know this has been a long answer to your somewhat simple question, but you know, to the extent that I sound discouraged occasionally when I stand here, it's because we still have people getting sick. And but I want everybody to understand that it's not that the mitigations aren't working. You saw that we put Tier 3 mitigations in, and just look at the numbers. I mean, you can see we hit a peak, and then we began coming down again, just like in the spring. You can see it on every one of the charts that we have. It lags when you talk about ICU beds, ventilators, and deaths. And that's the frustration to me, too, is that I still see very high numbers in those categories that concern me greatly. But the mitigations do work, and the more that people will follow the mitigations, the more they will work.
Governor, if I could follow up on Rick's question. When you were running for governor, you skewered the Rauner administration for taking 3 days to do a site visit when Legionnaires broke out in Quincy. It took your administration 12 or 13 days to get there. When you then found out that the hand sanitizer was inadequate, PPE was inadequate, are you holding your response to a different standard than candidate Pritzker did? And could you have saved more lives in that facility had you gotten in there sooner?
Well, first of all, we acted much more intensely and much more intently than the Rauner administration ever did. They tried to cover it up. That is what is so disturbing about what happened at Quincy those several years ago. We're doing everything we can to make it transparent. We've done inspections. We've uncovered things that would need to be changed, and we've made those changes. And as I said in answer to Rick's question, it is our responsibility to take care of these veterans. There's no doubt about it. And to act as quickly as we can when we know this information. Remember that the families weren't notified at Quincy several years ago. Families were notified within 24 hours of the testing that took place and 24 hours of the facility knowing that it had a problem. Is there more that could have been done? I don't doubt that there is more that could have been done. It is easy in retrospect to say that about really almost any situation. But I will also say that our intent here from the get-go has been to take care of these veterans and make sure not only do we learn what mistakes may have been made, but to rectify them. Last thing I'll just say is that the Legionnaire's disease is extraordinarily preventable. It is in the water supply. We know where it comes from. We know that you can either deal with it within the water supply or make sure that on the other end that we're not causing mist and other things in hot showers or in the delivery of hot water to people that they inhale it, right? You can prevent all that. It's known. This is a novel coronavirus today. This is not Legionnaires. And in that novel coronavirus means that no matter what we do, and it's a little bit the answer I gave to Eric as well, no matter what we do, even if we put all the mitigations in the world in, sometimes because of the prevalence of the disease, because we don't exactly know everything about it, it's not preventable for everybody. And so I want to make sure that we do everything we can and learn from the experience and not hide anything and be as transparent as possible so that we can get better.
One last thing, if you don't mind. Who bought the PPE? Who bought the ineffective hand sanitizer? Is that done on site? Is that done by IDVA? Is that a CMS master contract?
I don't know off the top of my head. I'll try to get you answers to, who the actual purchaser of those different things. I do want to point out that we have plenty of PPE on site in these locations, and have had for some time, certainly through this incident, and this tragedy that's taken place at LaSalle. And then on the hand sanitizer front, I don't know how that could have happened. But I will say that there were two kinds of hand sanitizers that were on site, types of hand sanitizers, one that was the effective kind and one that was not. And I don't know how that one that was not, that was in some of the ones that are attached to the wall, got there. And I certainly want to make sure that I know that we've replaced it. At least that's what I've been told by, in any place where that was the case. But I want to know everything, and I think that the public should know, how did that end up happening.
Governor, can I follow up on that? You've been asked this question earlier in the week. You took personnel action against the administrator there.
Yeah.
Also disciplinary action against the nursing supervisor.
Yes.
There. Was this a matter of specific instances it was a result of specific incidences of mismanagement or wrongdoing, or was this an accumulation of them? You haven't really elaborated on what was the trigger for you to take that action.
Well, it's an accumulation of things during this entire matter. But suffice to say that there are things that are just unacceptable, like hand sanitizer not being in the right type being in the right place. That's just one example, but certainly, this is a personnel matter, so I want to be careful about how we discuss it here. It's a legal matter, but I just, I wanted to make sure that the people who live in those facilities are as safe as possible, and so we put a terrific leader in Anthony Vaughn in charge of that facility.
We'll do one more, and then we got to get online.
Can you confirm that there have been no new cases at LaSalle, because they haven't posted any updates since the 5th on the website?
I announced yesterday any new cases. I haven't learned of any today.
I mean, the death on the 32nd, I think, was announced, or the 32nd death was announced the 5th, I think, on their website. So.
And we announced one yesterday.
Okay.
We announced one yesterday.
Okay.
So.
Jim Haggerty at the Rockford Advocate. Does the state have a plan in place to treat those who may have allergic reactions to the COVID-19 vaccine, and if so, what does that plan look like?
What was the first part of that?
Does the state have a plan in place to treat those who may have allergic reactions to COVID-19, and if so, what does that plan look like?
I think I'd hand over to the doctor for that. Sorry.
No. So again, we'll be waiting for the final word in terms of what's listed in the EUA, the Emergency Use Authorization. We'll be waiting. We know that there will be a publication that will come out on Monday from the CDC through the MMWR, the Morbidity and Mortality Weekly Report, the publication by the CDC, which will likely identify some of those recommendations, but I'm imagining that it will suggest, given the information that we saw from our colleagues across the pond, that maybe they will ask people who have a history of anaphylactic reactions maybe not to take it initially until we know maybe more. People who have that history of anaphylactic reactions, if they were somehow insistent on proceeding, if it's not an official contraindication, there's a period of observation that is supposed to take place following vaccine administration to look for such reactions, and people who have a higher propensity of maybe having one would have their EpiPen available in the medical settings where it would be administered. They would also have access to that emergency care. So I think we'll get more information from the FDA and the CDC, and I think healthcare professionals in the settings know how to handle emergency reactions when they occur, but there may be the recommendation for people with a known history of that not to get it.
John O'Connor at the AP, have you given any thought to a constitutional convention to fix Illinois' fiscal problems or other problems? Could a fresh look at taxes, for example, be more successful than a ballot question with big money opponents?
No, I have not considered a constitutional convention.
Dave McKinney at WBEZ. Governor, what was your reaction to Congressman Boston LaHood joining in the amicus filing seeking to overturn the presidential race? Should these congressmen and others who join them be seated in the new Congress?
Well, there I think were more than 100 Congresspeople, Republicans all, who signed on to that. I'm surprised. I mean, I think in the land of Lincoln, I think of Republicans and Democrats as being a lot more reasonable than the people who have followed Donald Trump down every rabbit hole. So I just would say it's irresponsible, and it's a ridiculous lawsuit. I don't know why they would sign on, except for apparently undying commitment and loyalty to a failed president.
Sarah Mansour at Capital News, Illinois. Governor, has your administration considered restoring civil immunity protections for frontline healthcare workers in nursing homes and hospitals that have become the subject of lawsuits since those protections expired back in June?
I think they're considering this at the federal level right now as part of the package for relief from Congress.
Dave Dahl, WTAX. Governor, Dr. Fauci has been talking about stay-at-home orders because of hospital capacity and also the holidays. Is a stay-at-home order a foregone conclusion?
I think I got exactly the same
I
question
thought I asked this yesterday, Dave, but if I didn't, I'm sorry. I might have missed it.
Sometimes people change a word here or there, but this is almost exactly the same question. Foregone conclusion. No, it's not a foregone conclusion. Tier 3 mitigations have been working so far, and so if people will continue down this road, we do not need a stay-at-home order.
Vincent Flores at CBS. Has the governor heard of any supply-side shortages of medical-grade freezers needed to store the COVID vaccine? And does the state have any plan to assist smaller hospitals that don't have the freezers if they're having trouble getting them?
Well, when you say supply-side freezer needs and shortages, we know how many freezers there are. We know where the vaccine will be stored in those freezers. We have enough freezer space right now for the vaccines that are expected to come. So in terms of a hospital that may want to have their own freezer, I can't speak to that. That's not something that we're specifically looking into. But we have enough freezer space to store the Pfizer vaccine when it comes.
Jim Leach at WMAY. Sangamon County says there is currently no vaccine allocation for doctors and nurses at our regional hub hospitals. Will the state ensure that these frontline medical workers treating the sickest patients will have access to the first round of the vaccine? I think this is because of Sangamon County is not in the first.
It's not in 50. The 50.
Dr. Zike could probably answer this question.
Yes, in our initial methodology, the 50 counties did not include Sangamon. Since then, we've made some revisions to our allocation to make sure that every regional hospital will get a portion of vaccine to distribute in week 1.
Charlie Meyerson at ChicagoPublicSquare.com. Would the governor like to address reports White House Chief of Staff Mark Meadows has pressed FDA Chief Stephen Hahn to okay Pfizer's vaccine by the end of the day or face firing?
I mean, only that we should not press the FDA to do anything that isn't scientifically sound.
Once approved, this is Marnie Pike at the Daily Herald. Once approved for kids, should schools mandate vaccines for students with exceptions for medical reasons?
We'll look at that. I think it will be, it will certainly be a little bit of time between now and when a vaccine is approved for young people. But certainly we're in the early throes of vaccine distribution. So, and I think that it makes sense for us in these early moments not to have a requirement. But certainly I know that we'll be looking as the months ensue here at the idea of, where, if any place, there may be some requirement.
Alex Fisher is asking how residents can find out when it's their turn to get the vaccine and when will the first doses be given out next week?
So it'll be quite some time between now and the general public having access to vaccines. That's because of the pace at which they're manufacturing and delivering it, and the numbers that they can manufacture, in any given day. So that according to Dr. Fauci and others, it may be April before we see widespread distribution to the general public. And in terms of people who qualify for the ACIP phases, that'll be quite well known already. We know what the 1A phase looks like, and ACIP is meeting, I believe, on Sunday to give us further guidance.
A.D. Quigg at Cranes will be our last one. Could you provide an update on budget talks with the four tops, and as we think about the vaccine being rolled out widely in 2021, how are you thinking about economic recovery?
Well, let me start with the last part. I'm very hopeful for economic recovery coming with a widespread acceptance of the vaccine. It will take some time to get what's referred to as herd immunity as a result of the distribution of the vaccine. So, who knows when that will happen, perhaps this summer at the earliest is what I am told. Meanwhile, that doesn't mean that we won't be experiencing some economic recovery between now and then. As more and more people get vaccinated, and I think the economy will be easier for us to open. But there still will be people who are vulnerable and people who won't have had the vaccine, and we need to protect them. They need to protect themselves. And so I think we'll see how that develops. But I'm very hopeful. And in terms of the budget talks and the economy, of course, has a big impact on our tax revenues for the state. So the faster the economy recovers, the faster our tax revenues recover. There are several things that affect our budget talks going forward. One is, everybody acting with goodwill and good faith in getting all of the best ideas on the table. As I've said, we've been working within the administration to find and implement cuts to the operating portion of, not the programmatic portion is much more difficult and something that the legislature needs to weigh in about, but certainly operating expenses of the state we can and are working on now. But we've heard nothing from the Republicans yet on what ideas they have for budget cuts, and I would like very much to hear that. I have continued to dialogue with the various leaders to try to encourage that. I hope that we see more from them. Meanwhile, I'm doing my work to make sure that we're moving toward a more balanced budget. And the last part of it is, remember, there are two aspects of what has unbalanced our budget. One is the one that I have pointed to for 2 years, maybe longer even as a candidate. But when I came in office, I really dug into every agency and into the budget in a fashion that allowed me to see what are the portions of the deficit that are structural in nature. So that that structural means you would never essentially have your revenues meet your expenses or your expenses meet your revenues. Truthfully, as you saw, I uncovered more than $2 billion of a structural deficit. We still have that. That still exists. We've made some strides because of some efficiencies that we brought to government, but we have more to do, and the fair tax would have allowed us to do that. That was the best solution. That's the structural piece. And then there is the pandemic piece. And that part, we need help from the federal government. There is a lot of discussion about getting that help. Cities need that help too. So many cities suffering, including the city of Chicago, including Aurora, Rockford, Carbondale. You can go throughout the state of Illinois. The 1,300 municipalities, everybody needs a little bit of help, and it's not just Illinois. This is a national problem. I want to remind everybody that Texas, which everybody thinks of as a terrifically balanced budget state, has an enormous deficit. So does Florida. So do many other states that are led by Republican governors, not just states that have Democratic governors. So I'm optimistic that if people will come to the table with good faith, that we'll be able to get this done in the spring session.
All right. Thanks, everyone.
Yep. Thank you.